Everyone often focuses on penis size, but have you ever stopped to think about the average length of the vagina? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to explore the topic of average vaginal length. If you've watched this channel before, you've probably heard me discuss the average penile length. When researchers study either erect penile length or stretched penile length, which is commonly used as a substitute for erection measurements, they find that the average penile length worldwide is about 5.4 inches. Around 95% of men fall within a range of roughly 4.2 to 6.7 inches. Yes, 6.7 inches. In fact, about 99.7% of men have penises that are shorter than 7.3 inches. For full penetration to occur, the vagina needs to be able to accommodate an erect penis. So it's natural to wonder what the typical vaginal size actually is. Let's begin by looking at what scientific research says about the average dimensions of the vagina. Several studies have examined this topic carefully. One study published in the International Urogynecology Journal analyzed MRI scans from 80 healthy women and measured different vaginal dimensions. The researchers found that the average vaginal length was about 9.8 centimeters, or roughly 3.9 inches, with measurements ranging from 5 to 14 centimeters, which equals about 2 to 5.7 inches. Now, before you think, wow, that's much smaller than I expected, it's important to remember that during arousal, both the length and width of the vagina increase. In fact, they can almost double in size, allowing the vagina to comfortably accommodate an erect penis. The study also measured vaginal width, and interestingly, it varied depending on where the measurement was taken. The opening of the vagina was narrower, while the area closer to the cervix was wider. On average, the width at the opening measured about 17 millimeters, or around 0.6 inches, and it expanded to about 45 millimeters, or 1.8 inches, near the cervix. The range could vary from as little as 9 millimeters at the smallest point near the opening to as much as 81 millimeters at the widest point, which is about 3.2 inches. Now, another study published in the American Journal of Obstetrics and Gynecology looked at about 3,200 women who were already visiting a pelvic floor clinic. Researchers discovered almost the same result, with the average vaginal length measuring about 9.4 centimeters, or roughly 3.7 inches. Another study conducted at Elizabeth Garrett Anderson Hospital in London examined these measurements in 50 premenopausal women. In that research, the average vaginal length was around 9.6 centimeters, or about 3.8 inches, with a range from approximately 2.6 to 4.9 inches reported in the study. Finally, a study published in the International Urogynecology Journal explored sexual function in more than 500 women. As part of that research, measurements were also taken. The average vaginal length was about 9.1 centimeters in sexually active women and about 8.9 centimeters in women who were not sexually active. The overall range measured anywhere from 5 to 13 centimeters, which equals about 2 to 5.1 inches. So the bottom line from research is that the average vaginal length generally falls between 9 and 10 centimeters, though the normal range is quite broad, typically between 6.5 and 12.5 centimeters. It's also important to remember that the vagina is naturally wider near the top, close to the cervix, and narrower near the opening. Many people already know that the vagina changes during arousal because lubrication increases. However, as I mentioned earlier, its size also changes. In terms of length, the vagina can extend through a process called tenting. During this process, the uterus and cervix move upward and slightly backward, creating extra space inside the vaginal canal. This can add roughly 1 to 2 inches to the vaginal length. There is also some widening that occurs because the vaginal tissues relax and expand. This allows greater flexibility and can make penetration easier and more comfortable. So what factors actually influence vaginal length? There are many misconceptions suggesting that certain activities can make someone looser, but research points to a few key factors. One is age. Vaginal length tends to decrease slightly with age, by about 0.08 centimeters for every 10 years, which is a very small change. Height and weight can also have an effect. Taller and heavier women tend to have slightly longer vaginal canals. For example, for every 10-centimeter increase in height, vaginal length increases by about 0.9 centimeters. Menopause can also play a role. Being postmenopausal has been associated with about a 1.7 centimeter decrease in vaginal length. In addition, having a hysterectomy has been linked to an average decrease of about 6.3 centimeters in vaginal length. Other types of pelvic surgeries may also influence the overall length as well. Researchers also noticed that other pelvic reconstructive surgeries were linked with about a 0.22 centimeter decrease in vaginal length. While these factors can show small differences, the changes are extremely minor and likely have no real clinical impact on how sex feels or how comfortable it is for a female partner. Over the course of a lifetime, the vagina may shorten by less than 1 centimeter simply due to aging. At this point, you might be wondering, then why do some women seem looser than others? It's true that the vagina can change in terms of laxity for several reasons, which I'll explain. But having more sex does not make the vagina loose, and it doesn't cause it to become more lax. Instead, factors like genetics, certain neurological conditions, pelvic floor problems, or even hormonal changes can influence the size, elasticity, and overall tightness of vaginal tissues. In many cases, the issue relates to what doctors call pelvic floor weakness. This can sometimes be connected to neurological or collagen-related conditions that weaken the pelvic floor muscles. Fortunately, these issues can often be improved with pelvic floor physical therapy, which focuses on strengthening those muscles. Exercises such as Kegels can also help support and improve pelvic floor strength. The key takeaway here is that the normal range for vaginal length is quite broad, but on average it is smaller than the typical penile length. Because the vagina expands during arousal and naturally adapts, the average vaginal length and the average penile length usually work together comfortably. With proper arousal and time, this combination can lead to enjoyable and satisfying experiences for a female partner. Of course, factors like age, height, weight, menopause, and previous surgeries can influence vaginal length slightly. However, these changes are usually so small that most women won't notice them, and they rarely have any meaningful impact. Also, having more sexual partners does not change the length or size of the vagina. I hope you found this information interesting and helpful. The most important point to remember is that if someone has an average penile length, it will generally work well with the average vaginal length. Of course, every individual is different. Some women may have slightly longer than average vaginas, while others may have shorter ones. But overall, the vast majority of people fit together naturally and are able to enjoy a healthy and satisfying sex life. And as always, remember to take care of yourself, because you truly deserve it.